to our first speaker. Our first speaker is Mr. Brian Denton. He is the hospital CEO at Mercy Hospital Kingfisher here in Oklahoma, and he is going to share his program they have at their facility, their Student Careers Council. So I'm going to stop sharing, and Brian, I'll let you share your screen. And also, since our format's a little bit different, towards the end, you can click unmute. You're allowed to unmute yourself. And so be thinking about what are cool things that you do in your facility for the needs assessments. What are cool programs or services that you've implemented? Because this is all about sharing and learning from others. So Brian, I'll turn it over to you.
All right, thanks Laura for the introduction. Greetings everybody from Kingfisher, Oklahoma. I've been asked to talk about and describe and just share some experiences about our youth program we have here at the hospital. It's called the Student Career Council. We've gone through a couple of different versions of this just since I've been here. However, this is something that started long before my time here. I came to Mercy Kingfisher in 2013 and inherited this wonderful program that, as best I could tell, was started in 1999 or 2000, somewhere about then. Started by a guy who had a similar program at his previous hospital and kind of brought it over to Kingfisher with him. And it originated as a program geared towards those high school students in the county, not just specific to our town, but in our county, that are interested in a healthcare career, most specifically nursing techs and therapists, and that's how it was passed off to me in 2000. And when I inherited the program, we had between 10 and 15 students each year, and these were bright students. I would say the cream of the crop of the ones who were interested in healthcare careers. So I saw an opportunity, though. For one, knowing the size of the community that I live in and the size of the community that we serve, I wanted to broaden this a little bit. I wanted to appeal to as broad of an audience as I could. And there's a couple of reasons that I wanted to actually use. I have 4 on this. Let's see, next slide here. What I wanted to do was expose as many people as I could to healthcare, and I come in there, all of it, not just nursing, not just pharmacy, techs, therapists, and then the medical professionals, the physicians, PAs, nurse practitioners. I wanted them to see more of it than that. I call back mostly on my own experience on why this came up. When I was a 17, 18-year-old high school senior, I grew up in a small town in southeast Arkansas. We had a small hospital, and I was, sure enough, naive to believe that there were only 2 kinds of professionals working in a hospital. There were nurses and there were doctors. And some nurses worked in the lab, some nurses took x-rays, some nurses worked in maybe respiratory or something, but I had no idea that there were special schools and programs that a person could enroll in and become a certified, licensed provider, maybe it's something besides nursing or being a physician. So assuming that I'm probably not the only person that ever thought that, of course, things are different these days, I get that. But I wanted to take an opportunity to make as many touches as we could using our hospital as the medium. So we include finance, we include our facilities engineer to talk to these folks, human resources, a lot of the administrative things. I have a session, actually I share with human resources. We go in and we talk a little bit about our background, what our jobs are, those kind of things. So I wanted to expose these students to more than just the traditional healthcare careers that maybe they get exposed to, through high school or maybe through a sports injury or something like that. So also, being in a small town, we've had like every other small hospital, recruiting can be a challenge. So this is also an opportunity. We get these kids, we capture them before they go off to college. This is, the boomerang type students. So maybe when they're an 18-year-old senior or college freshman, the last thing on their mind is returning back to their hometown to work and to live. Sometimes they sail out of here and it's a one-way street. A lot of times they come back, and we know our best chance of getting them back is to make sure we provide a good experience for them here. So it's always favorable. We try to make it fun. And we want those bright kids coming back. Also, something that I've noticed, I'm an example of that. And my gosh, if I were to go down the roster of our hospital here, I would bet most of the coworkers here, I know talking to our leadership here, there's vast majority of them did not choose their medical career immediately post high school. They went to college maybe with another map in mind, with another career path in mind, and something happened. Maybe there was a personal event, maybe it was a family member going through a medical event of some kind. Something happens and they get drawn to healthcare. So this is also one of the reasons that we changed our model to kind of go back to that 10 or 15 number of students that we had years ago when I inherited it. I wanted to appeal to all students. So maybe not just those who are interested in healthcare. How do we appeal to the students who maybe want to be engineers or architects or some other professional, working in the oil field industry, which is a big thing in our local area here. I wanted to appeal to those. So we removed the qualifier of you have to be interested in a healthcare career, because also there's a component of that maybe you're an architect, maybe you want to be an architect, but things become so specialized once you get down that path that maybe they could have a chance to specialize in designing healthcare facilities, clinics, and hospitals. Maybe get hired on by a system and be the healthcare system architect or work in that division. So the way things have evolved, in the past 15, 20 years, you don't have to be a specific healthcare provider to work in healthcare. So we've expanded our program. It was 2014. I asked our director of the program to kick it up a notch, to make it cool, make it fun. How do we make it interesting? Make it more than just getting together once a month throughout the school year and listening to some speaker talk about their career path. How do we make this fun? So that first year and the first thing she recommended doing was peel off the qualifier of healthcare careers, because what if somebody changes their mind, like I'd mentioned, or what if somebody has another career path in mind and don't think that would lead to healthcare, but maybe it does someday. So we removed that. That first year, we increased from 15 students to 30 students. We doubled the number of students enrolled. And I didn't keep the numbers. I wish this was one of those things I kept score with. I remember looking at the average GPA of the students in the ACT score and was just blown away. Looking at thinking back to my own time when I was in high school, I would have been one of the reasons that the GPA wasn't higher. And the average ACT score wasn't higher than what it was. So we've been able to build this program up to where it truly does attract and draw in the brightest that our high school seniors in our county have to offer. So that first year we kicked it up to 30 students. In 2018, just last year, we had 45 students. That was our biggest year ever. And we have to keep in mind, so Kingfisher High School is the largest high school. We average about 100 kids per grade. So there's roughly 100 seniors to choose from. Hennessy High School, they run maybe 50, 60 students per grade, and then it really starts dropping off to small schools in our county after that. So when I look at this number and I see we've gained 45 students from our county, the county only has 20,000 people in it. So when I look and see that and it's also specific to high school seniors. So we don't open it up to underclassmen, only seniors. So when I see that we have 45 students that are participating in our program, we're definitely doing something right. So this year, I did keep score. I did start keeping score of the average GPA and the ACT score. This year we have 38 students that are enrolled. The average GPA is 3.7, and the average ACT score is a 27. And again, looking at this, I would be the reason that it wasn't 28 if I was in this program, and we won't talk about high school GPAs. But it was, so we're maintaining that level of appealing to the, I guess, to the bulk of the kids, not just those who are interested in healthcare. And I was able to attend the last month's session. Turn the page here for us. Okay, so I've got some pictures here, and that's really, the next couple of slides are just photos that kind of, for me, tell a better story than just words on a slide. We see the top left there, we have a free clinic here in Kingfisher, and these students, because of their relationship with the hospital, they're actually enrolled in our organization as volunteers. So they're able to go out on behalf of Mercy Hospital Kingfisher as volunteers out in our community. So when we go to the Compassion Clinic here in town on the second Monday of each month, they're able to assist with that on our behalf. So while they don't actually draw labs, they don't actually lay hands on patients and do triage. We actually have the licensed staff do that, but they're able to help. They're able to help make sure the rooms are turned over in between patients. These two here are manning the lab table to make sure that the intake of the patient, name and date of birth, what kind of tests they having done, those kind of things get managed properly. You see bottom left, I think that's just a composite picture of last year's graduating class, and then the one on the right, that's right before one of our, I believe that was our spring event last year. We have two big events each year. They're both 5Ks. One is in November. It's our cold turkey trot. So one, it's cold usually when we do it, and it's around Thanksgiving when we do it. It's also the objective is to help the awareness around tobacco cessation. So the kind of play on words with quit cold turkey. And then we have a spring 5K that's around the same time as our Relay for Life event here in the town. So it's kind of a dual event. As far as the 5Ks and all of that, we allow the work to be done, and it's managed by these students. So they make sure we have the chip timers, make sure we have T-shirts ordered, make sure we have, if there's vendors that are coming, they get to manage the whole thing. So what this did was allow them to see.
Well, hello there. How are you?
Hello. So what we allow them to do.
Cool.
Yeah, what we allow them to do is manage the program, manage the event, and get a sense of what it's like to be a good corporate citizen in the community, more than just helping out with the local food bank. They actually get to organize and be the planner of an event. They get to drive it. So that's something that maybe they wouldn't get to experience in another program somewhere. Something else I want to talk about around the grassroots recruiting. Currently in our organization, we have 5 current coworkers that are past student career council members. So for us, I certainly would say it's a success to say the grassroots recruiting is working. And I think each one of these 5 students, when they set down on their college journey, none of them had an idea that they were going to be working in healthcare someday. One went on to finish graduate school and now is back here working as an operations supervisor, and she's actually one of the co-directors of the Student Careers Council program right now. So there are other projects that we do. We have the 2 big events. That's kind of the main focus in the fall and in the spring of the students. We also do on-campus things. Most recently, and I'll turn the page here. we painted the curbs. So we had, you see the middle slide in the top left, the middle picture in the top left picture. We had a need here. Just over time, the Oklahoma elements just kind of beat down on the paint here, and we needed to repaint our fire lanes for the hospital. So we had had an event. We've got eager students who are looking for some way to spend their time. We had a need, matched it up, and repainted the curbs here. So I think we had about 20 of the kids come out and help with that little project. And then you see on the bottom left and the far right, that's I think last month's or maybe the month before session. And so we have an air evac base here on campus, and they were the topic of the month. So again, not just hospital-based careers, and it was, so you see on the right, the helicopter actually had a call during the actual presentation. So the paramedic, the flight nurse, and the pilot had to leave. However, the mechanic and the secondary crew were able to stay back and talk about the program. So the program wasn't a total wash, even though the helicopter got to leave, and they got to watch the helicopter take off, which, you know, every time I see it, it's just pretty cool to watch. So trying to expose these kids to something besides just hospital stuff. So we're able to integrate in the air evac portion, and you can see just a picture, and that's this bottom left. That is this year's enrollment for the students. So one more thing that we do, and then I'll stop talking for a little bit and open it up maybe to questions. We have a volunteering program. So I started this when I came here, and it stemmed from the desire of the students at the time. I think it was the second year that I was here, the second cohort of students that we came through. They wanted to spend more time in the hospital, getting real life experience. You know, it's kind of a day in the life of a nurse or a tech or a therapist or in the finance department or in health information department. What is it like back there? So, you know, wrote a new policy, wrote some criteria, wrote an orientation packet on how to keep these kids and the students and the hospital organization in compliance with all the regulations and, you know, around HIPAA and corporate compliance and safety and all this. So the qualifier is, as long as they are enrolled in our Student Careers Council, that's the gatekeeper. So they have to go through all the onboarding. They have to go through orientation and be a part of the organization. So once they go through that, there's an additional layer should they choose to accept it. And we have roughly half of each cohort will choose to participate in the volunteering program. And it's up to them to buy their scrubs. And we, you know, give them, you know, they're able to take advantage of the discounted rates for scrubs and that kind of thing. But we require them to dress like us, to look like us, to be a part of the team. And they can volunteer as many hours as they want to. Of course, you know, they're full-time students in high school, so a lot of times that's evening shifts or weekends or holidays, or you know, when whenever school's not in session. But it's allowed them to take this one step deeper than just that once a month touch point where we call them in for an hour and a half and, you know, feed them pizza and talk at them. They get to experience it. They get to live it. So that's helped enrichen the program a little bit. So right now, that's where we are with things. We have the two big events. We have several little things through the year. The curb painting is just one example of that. We have a program once a month. And then we've escalated in order to enrich the program, the experience, just in the last probably 4 years or so, with this volunteering program, allowing the kids to spend more time alongside the coworkers, walking in their shoes on what is it really like to work in the ER. And we've had a couple that are interested in becoming, you know, through the physician path, or maybe the physician assistant or nurse practitioner path. So what's it like working in the ER? And we'll put them on call. So if we get called to see a patient in the ER, we call them, and they get to come in at 2 a.m. and you know, work just alongside the physician assistant in the ER. So really give them a taste of what it's like working at a hospital. So with that, that's in a nutshell, 20 minutes or so. That's what we do here for with our Student Careers Council. It stemmed from a program I inherited several years ago, and I think it's something that's going to carry on for years to go in the future. And Laura, back to you. I don't know if we want to open up to questions now, or if we want to wait until Tiffany goes and take questions then.
We can take some questions now. Well, if you want to stop sharing your screen and Tiffany gets hers loaded. Everyone, I think, might be muted, but you can go in and click to unmute your line. If anyone has any questions, this is a great time while we're kind of switching gears. Or you can chat too. I'll be watching that. All right, well, since I don't see any questions or hear anyone right now, we'll turn it over to Tiffany. Tiffany is a provider. She's a nurse practitioner in the eastern part of Oklahoma at Eastern Oklahoma Medical Center, and so she's going to talk about their school telehealth program. Tiffany, I will turn it over to you. Tiffany, you might be muted. Okay, Tiffany.
Can you hear me now?
I can. I'm so sorry.
That's okay. Classic line, right? Okay. Well, hello, everyone. I'm glad you were able to attend. Laura informed me this morning we had a lot of people on the webinar that's not from Oklahoma, so we're happy to share our stories that's going on here. So I know we're pretty proud of our school-based telemedicine program. Mr. Denton, that's a great program. It looks like you've got Kingfisher, so I'll have to look into that to see if maybe we can get something started like that around here. So, because I think it would be great. Well, as Laura said, I'm a nurse practitioner, and I've been at Eastern Oklahoma Medical Center for the last 15 years. And I'm going to talk to you today a little about our school-based telemedicine program. So just a little bit about us, so you know where we're at. We are located in LaFleur County. It's the little blue area there, way down in the southeastern corner of Oklahoma. We are county owned. We was founded in the 50s, and we serve around 50,000 people within our county. Have a very large square footage as far as county is concerned, but not so big on the population. We're just really spread out with it. In 2015, we received Rural Health Clinic certification for two clinics. We have one here in Poteau where the hospital is located, and then one about 10-15 miles south of Poteau in Heavener. So we have a couple of rural health clinics, and then we got our critical access designation that same year also. So kind of some services that we provide, just the general critical access services for most hospitals. We consider ourselves a big little hospital. We actually have a labor and delivery unit. Being a critical access, I think that's pretty rare. I think there's 3 in the state with it, but we are one of them. Got an outpatient surgery, sleep study, full service, 24/7 radiology and lab services, in addition to the inpatient and outpatient services that's provided by many hospitals. So this is our hospital mission, and kind of going back, we recognize that it's our mission to serve all of LaFleur County citizens, including the children. We recognize that we need to improve the access to care within our county. Like many Oklahoma counties, we have a large Medicaid population, and while they have medical coverage, they aren't always able to receive the medical care that they need, either due to socioeconomic or access to care issues, such as the parents not being able to take off work, gas money to get to the doctor, gas money to get to the pharmacy, or just the ability to get a same-day appointment when their kid gets sick. These are all very, very real situations in our county. We are considered a medically underserved county by HRSA, and so we know firsthand how our children can suffer because of inability to access the medical care needed or not have the medical coverage that they need. So in evaluating our strategic plan and community needs, we were looking for ideas to improve our community outreach and the care that we provided to the county, because that's why we're here. Like I said, we're county owned, so we are here to serve the county and the citizens of LaFleur County. During one of our administrative roundtable meetings, the idea kind of got brought up about school-based telemedicine. We kind of fumbled it around, trying to figure out, well, is that something that we can do? I think it's really expensive. How do we go about it? Kind of all those ideas, trying to figure out how we get there. But, at the end of the day, it seemed like the perfect opportunity for us to reach out to our community and better serve our needs. And with that, it's one of those things of, with them having the medical coverage is great, but if they don't have access to it, then how do you really help them? So with school-based telemedicine, you go to them. So you improve convenience for both the parent and the child. So overall, it's great in general. So this is, of course, the ATA's definition of telehealth. And of course, we had to do our research on telehealth, especially school-based telehealth programs. Had to figure out state and federal laws, telemedicine in general, the way new services, this is very new, or we thought it was new to be delivering healthcare. What we didn't realize is that for years, most hospitals, even across the United States, are using telemedicine, and most of them don't realize that they're using it. If anybody contracts with the DIA to read their radiology exams, that's telemedicine. We send the images to the radiologist, they read them, and they send us back their report. That's telemedicine. So a lot of people, they think it's new and all of this, but it's been going on since the 70s. It's not been put out there for everybody to identify. So we just took this as another avenue to improve access to care, reduce healthcare expense, and improve socioeconomic barriers to the patients that we serve. We had a very high utilization of emergency room visits, especially with kids, and a lot of them were just kind of clinic visits. They weren't really emergency room visits in our area. So we thought this might help better serve them as far as getting those healthcare needs to them and reduce the expense of coming to the ER and getting a full workup with it. So when researching the project, we identified some benefits of school-based telemedicine, and some of those were improve and promote the availability of healthcare in rural and underserved areas, which fits our county to a T, reduce the barriers to care that exist in rural communities, and improve access and convenience to care patients. All these just seem to fit with our hospital mission and our plan to better serve our community and meet their needs. So with some of the evidence that we found when we was doing our research on these programs, McConaughey noted 94% of parents surveyed about their telehealth experience, that the conditions treated would have led to either a doctor's visit, an urgent care, or an emergency room visit. He also noted that telemedicine had the potential to reduce healthcare expense, mainly due to reduced emergency department visits. Many times, our kids exhibit symptoms during school. However, we don't get to lay eyes on them until after work, and by then all the doctor's offices are closed. This results in late night emergency room visits, which you don't just spend an hour in the emergency room. So if you get there at 7 o'clock, you're usually there till early morning. So the parent winds up missing the next day of work because they spent all night in the ER. The child probably ends up missing the day of school, whether they needed to because of the illness or because everybody was just tired. They still miss a day of school. In treatment with the school-based telemedicine program, it can begin right then when the child starts to exhibit the symptoms. 91% noted that the telemedicine program allowed them to stay at work, and 63% reported a reduction in the absence from the classroom. And that was one of the biggest pieces of it too, is, it's not just physical health that we are interested in helping our community. It's the mental health aspect of it. But even with the physical health, they have to be physically healthy and mentally ready in order to learn appropriately in their classroom. So all of that stuff kind of goes hand in hand with it. So I want to talk just a little bit about programs kind of around the country that kind of gave us an idea of how to start school-based medicine and kind of where we wanted to go with it. Children's Health is a school-based telemedicine program in Dallas, and they noted about half of their emergency room visits occurred during the daytime, and most of the parents expressed the inability to get off work, lost wages, and sometimes job losses. We have the same situation in LaFleur County. Many of our jobs are factory type jobs, and they have a very strict attendance policy or point system. And unfortunately, these organizations don't care why the parents miss. It's one of those 3 strikes you're out, or you have 6 points, you lose your job. We all know that our kids don't get sick at the same time if you have multiple kids. So this could wind up with the parent missing multiple days, and even just waiting for a doctor's appointment may be multiple days. Children's Health seen over 10,000 telehealth visits since 2013, and the educators reported the students returned to the class in minutes rather than days. So this benefits both the student and the school. It contributes to the continuity and learning, but it also contributes to the financial bottom line of the school system, as attendance drives funding. So we have a lot of small schools in this area, so this is really huge for them. Nicholas Children's Health System in Miami identified that 67% of their kids would have likely gone home if not for the services, and 32% of parents would have reported that their children would have missed more than 2 days of school with that. They also noted that about 93% were satisfied with their visit, so that's always great to know. These are a couple more programs. One out of Maryland. Sorry. They note that they're quickly able to rule out contagious disease and either send the child back to class or get them the medical treatment that they need and send them home so they can return to class sooner. North Carolina, the Rural Health Innovation noted at 89% return of their students to class, and Texas Tech noted that 90% of what's seen in a pediatric clinic can be seen via telemedicine. So these are a few programs just around the country, but there's a huge program in South Dakota. There's lots of programs in Texas and Georgia and South Carolina. So we were really excited to bring this idea to Oklahoma, especially starting in our community. We could really see the big picture and how this can impact our community's future and hopefully, meet the needs that we were looking for with this. So this was just kind of a few of our program goals, starting out kind of big picture type stuff. What did we really want to try to work on when beginning this program, and how do we get it there? So we had a couple of meetings with some of the schools in town, in the area, just to kind of see what their idea was, if they were even open to having the program. Because if they had said, no, I don't want that, then that would have shut us down immediately right there. So really engaging the schools and getting their buy-in was a huge part of this. And so we were lucky enough that our superintendents in the county are really strong believers in this program. So we're doing really good with it. So this is kind of our model that we use. So how a visit typically happens is the student or the educator presents to the school nurse's office. She kind of takes a look at them, gives them a once-over, decides whether they need a telemedicine visit or do they just need a Tylenol and sent back to class. If she thinks it would help, I'm sorry, I've got Oklahoma allergies going on, so I'll apologize in the middle of this. If the school nurse thinks that the telemedicine visit would help, we first call the parent just to let them know that the kid's sick. We want the parent to know what's going on, that little Susie's got a snotty nose and she's complaining of a headache, and she might just have some sinus stuff going on or something like that. So school nurse notifies the parent, and she makes sure that we have a written consent before the visit. We usually send out packets to all the students at the very beginning of the year and try to hit multiple open houses at the schools, either before they start or once they get started, so we can educate parents, educate the educators or the teachers in the school, because they're huge in driving this program also, and try to get these kiddos signed up before they get sick. But once we know we have a consent on file, and we've talked to the parent and they say, yeah, we go ahead and call every time, just so they're in the loop. And so mom and dad know, and they go ahead and say, yeah, go ahead and put them in front of the service. We offer to let them come up so they can sit in the room with the patient and, attend the visit if they would like. It's no problem at all. Or if they can't make it, then we call them on the phone afterwards to let them know what's going on with it. So she then calls the clinic, lets us know we have a patient and what school she's with. So she gets the vitals and places them in the system of our telemedicine program, in the electronic system, so we can see them. The nurse practitioner then logs onto the system and calls the school through the HIPAA compliant network of the system that we're using. And then the nurse practitioner interacts with patient, you know, asking the medical questions, the history, present illness, medication, allergies, what medicines they're on, how long's this been going on, any other symptoms, you know, those types of things that you would typically do in a face-to-face visit with the patient. So they do their assessment with them. It's just over kind of like a Skype type session with them. Then after we get our history questions, we move on to the exam. We've got a digital otoscope at each site with the school nurse. She activates it through the program. So the nurse practitioner is able to examine the eyes, examine the ears, the nose, the throat, the skin, if they have some kind of funky rash. I treated some poison ivy the other day over telemedicine. So we can do all of those types of things, and the student never has to leave the school. You know, the kids think this is the neat part of the exam because they get to see what's on the screen and what we're looking at. And a lot of times we have, or at least the school nurse has a little bit of difficulty containing the kid because she's trying to maneuver the otoscope in the ear, and they're trying to look around her so they can look at the screen and look at either their earwax or their nose boogers or something like that. So they really like that part of it because they get to see inside their ears, inside their nose, inside their throat, and all of that stuff too. So, but once that's been completed, we hook up our stethoscope and we're able to listen to the heart and the lungs. So that's always kind of a full assessment that we can do with the patient. Occasionally, we have the school nurse kind of perform some maneuvers to test for tenderness, like whether we need to see if they've got some sinus stuff going on or are some lymph nodes enlarged or tender or anything like that. And that typically completes the exam. So all these visits are in real time. There's no storing forward. That takes on a whole different set of laws that we didn't really particularly want to mess with. So we do everything in real time. Nothing's recorded. And then once the visit's complete, if the parent's on site, we give them the discharge instructions and allow them to ask the questions that they need. Or if the parent wasn't able to attend, then we give them a phone call and just kind of update them on the findings. We called, you know, what pharmacy would you like us to send this medicine to? We send it to their pharmacy of choice, you know, make sure that they drink lots of fluids, you know, rest, Tylenol, ibuprofen, just the general discharge instructions that we would give them as if it was a face-to-face visit. So this process has worked very well so far. I've had lots of parents say, I'm so happy that, you know, we were able to do this. I couldn't get off work. So you know, this really helped us out. One of the school nurses told me the other day that if this program hadn't been in her school, that a child wouldn't have received treatment for strep throat. She said, I know the family, and they would not have taken her to the doctor. They would have kept her out, because I think it was on a Thursday. They would have kept her out of school on Friday and through the weekend, and would have sent her back home Monday without any treatment or anything. But this way we were able to get her antibiotics sent to the pharmacy in their hometown, so they didn't have to drive to Poteau to get it or anything like that. So they were able just to go pick that up and go home and start that medication that day. So it worked really well. Who we care for? We care for the entire school. If this program is in your school, you were able to use the service. Initially, when we first started brainstorming on this, we were really focused on the kids, but then once we got to talking about it, we was like, you know what, teachers get sick too. So why not open it up to them? So since we've opened it up to them, we have had a fairly high utilization of students to employees of the school. So the whole school is using it. So we were really excited to see that was going on. And that only increases the community outreach to serve the county as by offering that service to everyone there. So what we care for, sore throat, earache, skin rash, cold, sinus, upper respiratory infection, flu, allergies, conjunctivitis. I told you we treated some poison ivy the other day. But we can also do point of care testing also. So at the school site, we can test for flu, we can test for strep, we can test for RSV, and do a urine dipstick on them if needed too. So right now we've got strep running around our schools. I don't know if you guys do or not, but that seems to be the most prevalent. Haven't had any positive flu swabs yet, but we know it's in the county. But the strips have been negative or have been positive within the school. So that makes it nice to be able, with the strep, you get on your antibiotic and you're usually able to get back to school within 24 hours of starting the antibiotic. So otherwise they would either have to go home because they were running fever, and then, sometimes it's several days, if not a couple of weeks, before they can even get in with their primary care provider to get the appointment to be seen, to be treated for the strep. So it makes it nice that they can just go and get it taken care of that day. So they're back in school and they're not missing important information that the teachers are giving them. So kind of some challenges that we've had with the program. Of course, this is, I wish we had been at this for 15 years like Mr. Denton has, but we just started this last year. And so we're still new in this process and still working out some kinks in it. But kind of some of the challenges that we've had is the first one is usage. So everybody is in the habit of, their child gets sick. Well, I'm just so used to going and picking them up and taking them home. So we had a great sign-up response in the elementary and the middle schools. We had less on the high school side, but getting the parents and the community educated about this program is kind of one of our big things with that. So we've kind of been working on that. I think we're improving it. I see it improving even more over the next 5 years with it, but that was one of our big hindrances when we first got up and going. Marketing has been another one. So again, getting parents to understand how the program works, not just that we're not trying to take business away from the local primary care providers. We are just increasing access to care. We want to be that stopgap of when your child needs care right then, we can handle it. So we, like I said before, we go to open houses at the beginning of the school year to our schools that's enrolled in this program. Post it on our website, post it on the school's website. We've had it featured on the news, on the local television stations, and also in the papers also, just to try to get mass communication as far as education on the program is out here, and to increase usage with it. So one of the biggest two hindrances that we've had within the last year is legislation and reimbursement. So we were very fortunate to have some great local state and representatives and our senator to help us with this project. We probably would not have been so lucky in getting up and going the way we have this last year if it wasn't for them. So when we were doing our research on the project, this was one of the biggest things that seemed to be a problem. So we were looking to outreach to a large, like I said before, most of our population is a Medicaid population. So we not only have to have the state laws, we have to comply with the Oklahoma Healthcare Authority rules. So kind of got two sets of rules we have to go by there, because that's really where this is driven for, is those students. So when we were talking back and forth with the OHCA, one of the things that was identified is that in the law, it stated when it had to do with telemedicine that the parent had to be present during the visit. Well, this totally defeats the purpose of the program. We're trying to keep parents at work, keep kids at school if at all possible. And if the parent is still having to take off to be at the visit, it's not going to work for this. So we worked with our senator, and I think there was 2 local state representatives, and they helped us get this bill passed as the State Bill 575 passed this last year. And the governor signed it and put it into effect as an emergency law. So this was a big win for us. It's not always that a law gets passed in 6 months. So, and that's really what happened for us. So everything just kind of fell in place with it. So we were very much indebted to our state legislators on this issue. So they helped us out tremendously with it. And so again, like I said, we have to follow the Oklahoma Healthcare Authority rules also. And so reimbursement comes into play with it. So one thing with telemedicine is that most insurances and Medicare, they use the same payment methodology as a face-to-face visit. OHCA had a little bit different rules. They actually pay, I think they still currently do, $36 a visit, which, that's fine. And they actually, so they defined a telemedicine visit for $36 and a telehealth visit for 42 or something like that. So when we went to them and asked them what the difference between telemedicine and telehealth was, they really couldn't tell us what the difference was on that part of it. So, and the rates were way below of what a regular face-to-face visit is. They're way below what insurance and Medicare and all of those other agencies pay with that. So currently we're in discussions with them about how we get their payment methodology up to date as far as telemedicine is concerned. So they are rewriting their rules kind of as we speak in order to facilitate school-based telemedicine program throughout the state. So we're excited on that front too, so that we can make not only a positive for our county, but a positive for the state. So I think that's a tremendous, excuse me, a tremendous feat for us to overcome with that. So we're excited with it. So when we first started our program, we had 2 schools that was very interested in it. And like I said, we decided to not only include the teachers, but everyone within the school system too. So if we were going to implement the program, we wanted to serve all of the citizens. And the schools have a lot of those people in there. So initially we wanted to start with a small school like Howe. They have about 690 students enrolled in their entire school. So to work out the kinks and build the program from there. But one of our employees' mom actually worked at the Poteau school system, which is it's a school system of about 2,300. She got wind of our plan and wanted to participate immediately. So we met with them. She explained that their rate of absenteeism, it really shocked me personally, and I think it shocked our whole administrative team at that time. Absenteeism in the elementary school averaged 20 days a year. 20 days. That's like half of the semester. In the middle school, it averaged 30 days a year. So, I mean, that's a lot of days. That's a lot of school and education missed with that. Of course, they couldn't attribute everything to health-related illnesses, but they really thought that the program could be beneficial in assisting decreasing missing days. So, of course, more days in the classroom equals improved learning and test scores. So one thing or some stories that they told us with that, especially with Poteau schools, is that they just noted a lack of parental participation. School was taking the students to doctor's visits to get the medicine and the treatment that they need. The school was using personnel to transport students to eye appointments, dental appointments, medical appointments in order to get the kids treated. It was also noted that the parents couldn't afford to take off work for several hours or sometimes half a day to take their kid to be seen for a 15-minute appointment. So this is also if the appointment was that day with their provider, which oftentimes is about 2 weeks in our area before you can get in to be seen. So many jobs, again, are in our area, the factory positions, and they work on, they focus on attendance with that. So their parents are threatened with job loss if they miss too much work. And a single mom with 3 kids has the potential to miss several days if the stomach virus hits or the flu runs through their household. So one day of missed income in our community can impact a family in the area substantially. So it can be one day of missed work means that they don't get to pay their electric bill, or one day of missed work means that they don't afford the rent. So it's very important to keep these parents at work if we can. So we wanted to do this in order to decrease the cost of missed work, decrease absenteeism rates in the school, and increase access to care within the county, and felt like this was the best way to do it. So new schools added this year. We've got 5 that we're onboarding this year, so we're excited about that. We've promoted this program within the county as an opportunity to invest in the future of our kids. And we're talking about this program to people in the community and, letting them know that we're looking for funding to help get this going, because our goal is to get this in all 17 schools in our county. And unfortunately, these units are fairly expensive. So, of course, we're looking for outside funding to help us get this going, because we're a critical access facility in Oklahoma. So it's not like we have a huge payroll or lots of money in the bank around here. So always looking for funding opportunities. And we've been very, very fortunate enough to have some businesses step up. A local bank chain purchased 3 units, and those units are going to be placed in Wilburton, Worcester, and Spiro schools. So that's about $60,000 that they donated. And then the local electrical co-op and another bank chain got together to purchase a unit that we put in LaFleur schools. And so what we decided with that one is we could actually share a unit between LaFleur and Fanshawe. They're both very small schools, and they're about 10 miles apart. So the superintendents have gotten together, and they have figured out a way to kind of co-op the unit so it can benefit both schools and those. So this has been a huge community outreach, and we're so happy that these businesses, can see the big picture and how this can impact our county, and that they are that they can step up and do this for us. So just a little bit about who we're seeing and what we're seeing. We actually were really surprised when we got the data back from last year's visits. We expected to see a majority of Medicaid beneficiaries when we were looking at who we were going to be treating, but it was almost split half and half with Medicaid and Health Choice on this. So of course, most of the people, if you're on from Oklahoma, Health Choice is the state insurance that the teachers participate in. So we were seeing, pretty much half students and then half school employees in the program. So we were really shocked when we got that back, but excited about it too. So in our first year of the service, we've seen over 125 visits at Poteau school system, which we thought was a awesome start for us. Being that, the school is 2,300, but we got 125 visits out of them. So we were, like I said, we were ecstatic to actually have that many participate in the program. So this is one of the teachers' responses, because I see her routinely out in the community. And so I asked her, I knew she had used the service, and I asked her, I was like, so what did you think about it? How did it go? And she couldn't say enough about it. She's like, oh my gosh, that, it saved me a day that I didn't have to take off work. So her story is that she woke up, she was feeling terrible. She was going to call in, but she knew we had the service at the school. So she come in early, got seen at 7:45 before school started, diagnosed with a sinus infection, and medicine was called in. She went and picked it up at her 10 o'clock planning period, and she was feeling better by the end of the day. So, this saved her from having to take off work. And as we know, if teachers take off work so many times, at one point in their year, if they take off too many, then they get to pay for their substitute. So it may even cost them to take off work at times towards the end of the school year. It also saves the school from having to pay the teacher and then pay a substitute to replace her. And like she said, she had her 12-year-old go through, and it was the same experience. So in that event, the 12-year-old probably wouldn't have been at school. So that would have been one student not there. So that could impact the school's funding. And then also the teacher would have likely taken off to take care of her 12-year-old. So we've had lots and lots of stories like that. And like I said the other day, I treated one, and it was, I just couldn't take off work. There's no way I could. I've got so many things going, and they were so happy with the service. So just excited that they were able to participate in. So just really, really nice responses from patients on this. So this is about the only statistics that we have. Last year, we really were trying to figure out how do we even collect statistics and all this, because again, this was so new to us. I really didn't expect the 125 visits that we got. So we asked the school system, we asked Poteau kind of what they seen for the year, because they were working on their data to improve absenteeism also. So that's kind of where we went with this. So this is their data that they collected. We have a better system now, so we will have better information as we move forward in this program. But in the 2018 and 19 school year, they were happy to report a 70% return to work rate for their educators and 70% decrease in absenteeism with their educators too. So that was huge. to the school. They also noted a 30% decrease in student absenteeism of the school year. So, you go back to those 20 days missed in a year for the elementary school and 30 days in the middle school, and that's a tremendous improvement with them. So, unfortunately, it's difficult to determine whether all of these, this decrease is all related to the school-based telemedicine program, but Poteau school system feels like it has a major impact in getting these results with it. So this year's enrollment in the program, we have over 500 students and educators enrolled that we have signed up among the 7 schools that we now have, and we expect this to increase as the school year progresses. So just because they sign up at the beginning of the year, a lot of times, we're coming on flu season, so they don't sign up until they need the service. So many times they're filling out the packet the day they're getting treated. So we expect this to go up as the school year continues. So especially going into 6th season and see what, excuse me, and see what happens with it. So, we're so excited to bring this to Oklahoma. And this is definitely kind of a trailblazer for us in this portion of it. So I think I probably talked way past my time limit, but we're just so excited about bringing this program and the success that we've already had this year. So being able to reach the community a lot better than we was able to 12 months ago. So I just want to thank you for your time. So Laura, I guess I'll turn it back over to you.
Okay, I had a question for you. Do all of the schools you work with have a school nurse on staff?
Currently, all but one.
Okay, so what does the school that doesn't have a school nurse on staff do? Just the office staff, or?
Well, she is, okay, so that one is fairly close to Poteau, so it's probably 10 miles from Poteau. So right now we are co-oping the school nurse at Poteau is the hospital's employee. So she, when Worcester is the school that doesn't have a school nurse. So if they have a student that presents that needs to use the telemedicine service, they call the Poteau school nurse and she drives to Worcester to operate the equipment. And the reason for that is it has to do with the Oklahoma Board of Nursing rules. So because we're using nurse practitioners to run this program and to see the patients, we're unable to delegate tasks to unlicensed personnel. So the school secretary isn't licensed in any healthcare field. And also MedAid is not able, we're not able to give orders to them. So if we were using a physician, they could probably use a secretary or something like that and have them do those tests. And it's not working the equipment, that's the problem. It's performing the point of care testing. So doing the flu strips and the RSV swabs and strep swabs and stuff like that. That's kind of where our biggest hindrance is. So,
Okay.
but right now the Poteau school nurse is back and forth between Poteau and Worcester.
Okay. Does anyone else have any questions for Tiffany? Well, I know we're right at 1 o'clock, and did anyone else have a program or something that they wanted to share that they do in their facility or something you guys are proud of? Well, thank you everyone for logging on today. And again, we didn't have the polling questions throughout. We have the keywords, which the keywords again were Thanksgiving and carrots. Log on SurveyMonkey afterwards and submit those keywords for your CPE credits. And thank you guys for participating. Thank you, Brian and Tiffany, for sharing your programs. If there's anything we can help you guys with or have any questions at all, please do not hesitate to contact us. I think my email was the one that sent the registration for this webinar out. Yeah, and again, if you have a great story or want to share your program with me via email, I love to hear these. So thank you guys for your time, and thank you both for presenting, and you guys have a great rest of your day.